Atlanta just outplayed them the first half.
So it is 5:30. Bob?
Behave yourself.
It's 5:30, so I think we'll get started. And we'll call to order the study session of the Grand Traverse County Board of Commissioners for Wednesday, February 8th, 2017. And let's rise for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's nice to have a crowd saying that. I like to hear that. Okay, Bonnie, will you call the roll, please?
Wheelock?
Yes, ma'am.
Mayor?
Here.
Lathrop?
Yes.
Johnson?
Here.
Gorfulet? Here. Klaus?
Here.
Crawford?
Here. So we will come to first public comment, and we'll have Bonnie read the rules, please.
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4, Order of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
Okay, so before we start public comment, I know there seems like a lot of people today who might want to come up and comment. We're going to follow the rules very closely today. So we're going to have to hold each person to the 3 minutes. Sometimes they let it go over, but today it's going to have to be 3 minutes only. And as you heard in the rules, each person gets to speak one time on a particular topic. And since our only topic today is Commission on Aging, each person gets one shot at your 3 minutes. Okay? So Bonnie has a statement to read into the public comment first, and then we'll put it out to the audience.
This is a memo or a letter from Comfort Keepers. It's from Leslie and Russ Knapp, dated February 8th, 2017, regarding the management services request. We are requesting that this memo be read aloud and entered into the record at the beginning of the board study session on February 8th, 2017. Thank you for the opportunity to relate our perspective on the Grand Traverse County Commission on Aging Management Services contract. Tonight, Comfort Keepers of Traverse City is respectfully withdrawing the proposal presented on January 18th. The reasons are: when we were approached last December by county officials to see if we could help solve policy, training, technology, and administrative problems at the COA, we were happy to look into it, mostly because we have enjoyed a long, mutually respectful relationship with staff at the COA, and because we knew our resources were a good match that would enable us to quickly make progress together. However, since then, the proposal has been inaccurately characterized by some as an effort by Comfort Keepers to take over the COA, and that its employees would have no rights. Unfounded, disparaging remarks about our company and people have hurt our hardworking employees who have nothing to do with this. Comfort Keepers is a nationally recognized, reputable organization, and we are proud of the work we do to support seniors and their families. We understand why county taxpayers and COA employees might have concerns about potential changes in management and a perceived loss of control. It's obvious that a much better understanding of all of the issues facing the COA, as well as the options available to address them, is needed before it will make sense to consider any proposal for services. Our interest in this contract was strictly driven by our desire to help the COA, its employees, and seniors in our community. We hope that by withdrawing the proposal from consideration, we are creating the needed space for a healthy exploration of the facts and dialogue about the bigger picture. We appreciate the confidence of county administrators in our ability to assist with this important work. Thank you. Respectfully, Leslie Knopp, Russ Knopp.
Okay, so does anybody have public comment they would like to make? You can step up to the podium and give your name. Give your name and address, please.
Hi, everybody. Hi, everyone. I'm Shirley Zarappa, 3930 Evelyn Street, Traverse City. That's enough, right? Okay. I came tonight for several reasons. Partly, I'd like to give you a little background. I have served on the Commission on Aging for more than 2 terms. I have been a client of the Commission on Aging for more than 8 years. I have been completely satisfied with all of the services, conversations, funding, and everything that they have done with me as a client. Now, realizing that the people sitting in front of me here have worked their tails off, trying to look at ways to be efficient, to shake the tree and let the dead stuff fall out, I have something that I would like to caution you. I wrote a few notes, and the first one is, before every effort has been made to have the COA board, administration, however you want to name it, before every effort has been made to let them become HIPAA approved, to let them do things in a financial and costly, money-saving and efficient way. I would not like you to in any way commercialize, I call it that, or vendorize the services of the COA. The clients of the COA are a special group of people. They're very, very vulnerable in so many ways, and the trust level that our field staff and the people that have worked in our homes become family to them. And I know that probably all the people who have been trained in helping seniors have that heart, or they wouldn't have gone into the job. But it's a family, and it's working. Now, we certainly need some tuning up on what we're trying to do, but the millage that was voted just this past year was approved by over 80% of our Traverse City people. And they did that, and I know many of them in their 40s who say, I want my mom taken care of. I love her, but I can't be over there listening to her telling me to get the oatmeal down, or do this or do that. And so they paid that money in order to have those services happen. We do need registered nurses. We have had one. We do need to improve. But the things that I've mentioned, I just hope that this board and administration can say, have we done every single thing we can to let the COA be in charge of the clients in Traverse City? Thank you.
Thank you, Shirley. Anybody else? Go ahead. You're fine. That's fine.
My name is Leslie Ray. I live at 304 West 13th Street. I am a subcontractor, I will let you know that, through Commission on Aging. When this all first came about, I didn't like it at all. I still don't like it because, for one thing, you never sell out your seniors. Would you sell out your parents or your grandparents? My grandma turned 99 January 1st, and I wouldn't like it one bit. You know, if you're corporate, it's about money. It's not about quantity and quality. And like the lady said, we are very, very much trusted. I know my people, you know. I know when to get turned around when a lady calls me and I can't understand a word she's saying, and I know she don't drink, but I know she's had a stroke. So I know when to get turned around, or, you know, call and have a welfare check done. We're their eyes and ears. Laura Green does an excellent job. Emily, Jill, everybody does. I know people that have given people baths, you know. They're very trusted. You know, people really, they count on the Commission on Aging to be there for them. And it's too bad, and, things need tweaking, but to look into some more services for them, because I'm on the other end of lawn mowing and stuff like that, for bushes or whatever, because a lot of the seniors are, pretty strapped just like everybody else is, to hire help. So, but I just hope that the board stays with Commission on Aging and all their employees. Thank you.
Thank you. Anybody else? Yes?
Hi, I'm Jill Case, 4442 West Daisy Lane. Currently, I am the program supervisor at the Commission on Aging. I have worked for Grand Traverse County 25 years. 24 of those will be at the COA in May. The concerns I had for the proposed agreement, and I still would like to state them, is the board has discussed employee morale, and yet that proposal did outline outsourcing current county positions, which did cause low morale in our department. No other options were brought to the BOC. Was this the most financially responsible way to accomplish becoming HIPAA compliant? Do you believe the voters passed the COA millage wanting public funds used for private entity? And did anyone speak to the taxpayers or the current customers about these changes? In the proposal, county workers who leave will be replaced by a contractor, and yet there was no cost given. The QAP and administration says that we are not HIPAA compliant. If they know we are not HIPAA compliant, why don't they work with us to ensure that we become HIPAA compliant? We have been without an RN supervisor since August. Her last day of work was August 2nd after giving a 3-week notice. The AFSCME union representative had to contact the county HR department several times to finally get it posted on August 15th with the incorrect salary. Interviews took place, however, no one was hired. Last week at a staff meeting, field staff questioned administration, and they were advised that the position was never posted. The QAP stated to staff at an October staff meeting that their recommendation was that the nursing supervisor needed to be at least a BSN, and the COA director would be a BSN master's. Why wouldn't these same standards set by the QAP be in place for the company that administration was now asking for you to approve? Currently, the Comfort Keeper nurse that we're contracting with is an RN. Administration conducted 2 QAPs on 2 other departments, and they outsourced part of that. Yet, with our department, they didn't outsource it. Yet, they also said they job shadowed. No job shadowing was done with us. The one thing I've learned working for the county and bringing things forward to you as a board or a Commission on Aging board was when we brought something, whether it was a new program, hiring staff, we needed an outcome down the road. How are we going to keep it functioning? In this proposal, it didn't do any of that. It was a 3-year proposal. When we would ask administration what's going to happen in 3 years, their answer is they don't know. So I ask that the BOC give the Commission on Aging staff the opportunity to accomplish these tasks by becoming HIPAA compliant, hiring a consultant, purchasing the software that we've been needing since 2003, hiring a nurse, hiring a director.
Thank you.
Thank you.
Anybody else? Okay.
My name is Emily Rice, and I live at 3080 East Avenue. I'm probably going to go over 3 minutes because I have a lot to say, but I would be more than happy to hand this off to somebody else so they can finish my thoughts. I'm here today to speak to you about my experience with the Commission on Aging. I worked there for over 19 years. I am the nursing supervisor who left in August for a different position. I'd like to advocate on behalf of the clients and the staff of the COA. The COA has provided exceptional service to the residents of this county for over 40 years, and it has professional, dedicated, and well-trained staff. In fact, they're the only COA in Michigan that requires their home health aides to be certified nurses' aides. The agency has passed millages with overwhelming support, has had extremely positive feedback from its clients, and provides services that are essential to the safety and well-being of our seniors in the community. In 2016, the COA touched nearly 1,800 seniors in this county with the services that they provide. That is amazing. Since my departure in August, many changes have been suggested and some have been implemented through recommendations from the QAP. So I'd like to summarize some of the things that have occurred. The COA board has been dissolved, and to date, no advisory board has been appointed. Administration has said this would happen the first quarter of 2017. Has this process even started? Staff have been told by administration that they're waiting until a director is hired. The COA director position was rewritten to require a BSN with a preferred master's degree. The rationale behind this was that the director a director with this knowledge and education would allow for better training of staff, implementation of best practices, and the ability to write and implement such HIPAA policies. So, this was the recommendation of the QAP. Why are these teams asking to go out for contract? Is administration hiring a director? Staff have been told that a job offer has been made pending background checks, but when you go out to the county's employment website, the position is neither posted nor pending. The director position has been vacant for 14 months. What is the delay, and is there really a director out there who's going to be hired? The nursing supervisor position has been vacant since August of 2016. Some of these responsibilities have been shifted to a contractor because the QAP felt that the supervision of the staff by an RN or a higher degree was essential until a permanent replacement for the nursing supervisor could be found. Since October, 5 different nurses from 2 different home health care agencies have been involved in supervision of staff and/or client assessments. There has been no continuity of care for the staff or for the clients. Staff was told on several occasions, and documentation is in your packet tonight, that clearly states the QAP recommended filling this position. When staff asked about the position, they were told it was never posted. If you look at the county's employment website again, it says that interviews are being conducted, which they are not. To my knowledge, administration has not notified the union of any changes to the position or the elimination of the position. And again, what is the delay into filling this?
Thank you. We have to stay with 3 minutes, thank you. Anybody else? Yes, ma'am.
Did she finish my thoughts?
You have someone to continue for you? That's fine, that's fine.
Hi, I'm Nancy Eckes. I'm a resident of Kalkaska County, foot care nurse. I'll finish up Emily's. The deputy director is now a quality assurance analyst. To my knowledge, a formal job description does not exist for this position, nor does a pay scale. It appears that this position was made up to assist the QAP. So what happens to this position when the work of the QAP is completed? Day-to-day department management has been shifted to Jen DeHaan. I can't even begin to imagine how Ms. DeHaan is accomplishing this. She cannot possibly have enough time to devote to day-to-day operations, especially when you consider the vacancies that exist in other county departments that she is responsible for. This has actually left the COA with less direct day-to-day oversight. So I ask, what has the QAP truly accomplished over the last 6 months? Yes, issues were identified and they need to be addressed, but the process itself was not transparent. Meetings were not open to the public or staff, and to my knowledge, minutes were not recorded. Jen DeHaan has commented on the process and has stated that there are many meetings that are closed to the public, including COA weekly staff meetings. Is this really a comparison considering that staff meetings are closed due to HIPAA and the discussion of clients? I don't believe individual clients were discussed at the QAP, so what is the real reason for the secrecy? Another concern is that only one staff member, Laura Green, and one COA board member, Rodetta Herend, were on the QAP, and they were instructed to keep discussions and content from the QAP confidential. Although Laura Green was the acting deputy director, it should be noted that she had the least administration tenure with the agency. Why wasn't the only other acting supervisor, the supervisor with 25 years of experience, invited to be part of this panel. She has the history and the insight, yet her expertise was not solicited. Has administration done an adequate job carrying out the recommendations of the QAP, and have they engaged all staff for solutions to the issues presented? Staff would tell you no. Although Jen DeHaan and Paula Sagala met with field staff and office staff, they would tell you that their ideas and opinions were not accurately represented with the recommendation of contracting. Although Jen DeHaan has stated that staff will remain employees of Grand Traverse County, the contract with Comfort Keepers clearly states that as positions open up on these positions, they will be replaced by Comfort Keepers. Office staff were told that the office would be restructured and that they could reapply for the positions. How do these changes not directly impact the level of service to COA clients?
Thank you. I think the lady in the stripes has asked several times in the doorway. She's had her hand up for quite some time, and then we'll go with the lady in the blue. Thank you.
Hi, my name is Christine Graham. I live at Fitzhugh, and it's Hillview. It's an apartment building. It's for retired people. It's for people with disabilities, mental and physical. And there are so many blue people, ladies dressed in blue, that come in on a daily basis. And I am here to tell you, and I have one of them that also helps me as I'm unable to lift a certain amount. Everyone that has serviced me has been excellent. I also had a mother-in-law that I put in touch with them 10 years ago, and people that worked with her, whether it was snow removal, helping with cleaning and so forth, was excellent. And also for the COA, I would like to say thank you for helping me so that I can afford transportation to donate my time in the community. It's a very enlightening experience. It helps me to keep a brighter, happier mood within my life, and that again is brought back into the home that I live in, well, the apartment building. So that up-spirited, smiling faces that come in and are so pleased to help us goes back out into the community. And I thank you for your time. Thank you.
Thank you. Yes, ma'am.
Geraldine Green, 214 East 11th Street. I guess what I was going to say has changed after Comfort Keepers has written a letter to you. I'm not sure what it is you're going to be talking about tonight. I really don't know. It's very interesting. But from the employees that I hear from department after department after department in the county, it has a very negative feel, not only for those employees, but for the entire community. And it's time to change things. And hopefully with your new board and the new structure that you have, you will do that. Now, there was a vote this fall for the Commission on Aging. And I know that many people are being served, but I think the county needs to do a better job of letting the 60-plus citizens of this community know what is available through the Commission on Aging. And I would hope that you would set up a program that would let that happen. Thank you.
Thank you. Anybody else? Yeah, go ahead.
Hi, my name is Rhonda Yanska, 6391 Pierce Road, Kingsley. I'm going to finish what Emily had written, and then I'm going to tweak mine a little bit because Comfort Keepers is no longer the option here. This is the end of Emily's. At your study session tonight, I am respectfully requesting that you, the BOC, not only look at the proposed contract with Comfort Keepers, but explore other options that allow the COA to meet HIPAA requirements and provide for training and supervision of staff. The contracting of these management services is merely one option. My hope is that administration has done their due diligence to bring you several options and the cost for each of these options, not just an easy way out or a quick fix to the problems at hand. After all, this is a study session. It is also my expectation that administration can show how the bidding process was carried out and how Comfort Keepers was chosen as a recommended provider over other agencies. Lastly, I would like to see some discussion on the recommendation of administration to return $700,000 to the taxpayers when there are clear and undefinable needs for these funds. Technology tops the list. My personal belief is that this department can move forward and bring forth change and improvements in-house and at a lower cost. A contractor brings nothing to the table that the COA, if given the staff and resources and support, is not able to provide. Contracting is not the right decision or direction for the future of COA. When the dust settles and this study session is complete, I am hopeful that you consider and allow staff to implement technology, hire a HIPAA consultant to provide a thorough and bipartisan audit of the agency and HIPAA compliance, hire a nurse supervisor, and move forward with the hiring of director and appointment of an advisory board. You already have talented and intelligent staff who are ready to devote their time and energy to make this agency successful. Engage these staff and empower them to make the COA even better than it already is. What I have written is just kind of what I do. I'm a home health aide. I've been with Commission on Aging for over 9 years. I am state certified, which means I've been through 4 weeks of classroom instruction and clinical training before I took the state test. I also worked 6 years at the Pavilion Nursing Home, which I feel prepares you for anything you may encounter at a client's home. All of our home health aides are state certified, and most have worked in nursing homes before coming to the county. With this training, I feel we provide an excellent and above-average service to our clients. Comfort Keepers no longer applies, but even any contractor, I'd like to know, how many hours of training they get because they're not state certified. Many clients have stated that when contractors come to their homes, they did not wear gloves for personal hygiene care, nor do they come equipped to do blood pressures, which are part of COA standards. Our clients have also expressed confusion with scheduling. Many times they're given multiple days and times, and a lot of times they don't show up on their days. As we all know, most of the senior population like consistency, and they look forward to the same staff member assisting them week after week, and thus allowing them to form a close bond with that worker. In conclusion, I feel it is important to continue with a high level of care COA has provided.
Thank you. In the back there, you had gotten up last time. I've heard, thank you.
Jenny Gruss, 2377 Cone Tree Road. I just wanted to share with you that the memorandum, I believe that the memorandum that was presented to you on January 12th lacks clarity, and it's based on a preformed decision that the COA actually needs to be a home health care service. We currently are an in-home service, and we provide programs according to the state operating standards. The state operating standards do not require HIPAA compliance for in-home services, but they do require that there's confidentiality, and we do have that. We've had the training. They also require that only one RM be present, and she takes care of with the assessments. Home care and home health care are distinct types of care, and both are provided in a home setting. Most people aren't aware of the differences and use the terms interchangeably. The key difference is home care is non-clinical care and home health care is clinical care. Non-medical home care focuses on helping the seniors sustain, maintain the loved one's quality of life in their home. The goal is to provide whatever support the senior may need to remain independent as long as possible in their own home. This is normally long-term care and can increase and grow as more help is needed. Home health care is supportive health care is medically driven and follows a medical need. Home health focuses on the need for additional support to remain safely at home. Home health care can make changes in a loved one's care. Home care is preventative and proactive, and home health is follow-up and reactive in nature. Our current in-home care is supported by our community and is private pay. The home health care is supported by third-party payers, can be more lucrative in recuperating the cost. Home care has no licensure requirements, federal or state. We follow the operating standards for the service programs, and in order to obtain an AANM contract, they require that you follow these same standards. We should be able to obtain that contract. The state of Michigan, the Office of Service to the Aging, did contract with PHI, a national company. They did a complete report. They determined that the best standard of practice is long-term supportive service.
Thank you.
And they have a plan.
Thank you. Anybody else would like to step up? Yes, sir?
Laverne Broughton, 611 Hastings Street, Traverse City. I come down tonight in support of our Commission on Aging. They did a wonderful job in getting my wife qualified for Medicaid. They probably saved me between $5,000 and $8,000. The pavilion up there, I find, is a much better nursing home than some of the nursing homes around here. The staff up there are doing a great job in running it. The care up there is really good. They took a great job of my wife. Thank you.
Thank you. Anybody else? Yes, ma'am.
Excuse me, my name is Dustin Tortorisi. I live at 3427 3247. I knew I had to write it down. Wood Duck Court, Traverse City. I've been a client of Commission on Aging for 5 years, shortly after I moved here from New Mexico. Most of what I wanted to say has been addressed, so I broke it down as much as I can. As far as Comfort Keeper, well, Commission on Aging is a not-for-profit agency. Hopefully, if Comfort Keepers doesn't come in, you don't get another agency that's a for-profit agency. Commission on Aging does more than provide services on client homes. They also help with questions, find resources, are always a willing ear, and all the physical help they provide, which is a lot. Comfort Keepers or any other agency that you may consider will be taking over management from people who know what they are doing and have built trust with the clients, and the workers there go above and beyond with what is expected from them. Commission on Aging clients get the same worker every time, so trust is built, and many workers are so trusted they're given keys to the home so the workers can go in when no one is there if it's necessary. This is a very vulnerable population, and change is difficult for many seniors. Voters voted on the millage on August 2nd, assuming it was for the Commission on Aging, senior services that they know and trust. It was passed by 83% of the vote, a landslide victory. People were not voting for Comfort Keepers or any other agency. And I don't know all of the facts or many of the facts, but I'm wondering why any of this is coming up at all. There's been no scandal, no crisis, no one's been harmed. As far as I can tell, there's no true factual reason for a change. Everything can be fixed. I understand from the paper the big issue is HIPAA noncompliance. That is an easy fix. People can be trained. I don't know what the other issues are. Commission on Aging, as I said before, is nonprofit. The people who work there do it for the love of their clients. Their whole focus is about service and clients.
Thank you. Anybody else want to step up? Yes, sir.
Good evening. My name is Willard Killey. I live at 207 East 15th Street, Traverse City, Michigan. I'd like to say first, I'd like to send love to everyone on the board. The soul in me, I'd like to salute the soul in you. I feel that the best job anyone can have is to improve the lives of another human being. And this service clearly does that. My mom receives this service, and I can see the benefits of that in many ways. It's a long-term relationship the Commission on Aging has had with the community over 41 years. Things are cyclical in life. They always come back around, give you another opportunity to do it again, do it better, improve it. Here we are at another time where we can be, as I would like to say, transformational, have transformational policies, not transactional policies, where we can go deep. If I could try to explain that, maybe like the cross symbolizes the horizontal plane of our existence on earth, and then the spiritual plane is the vertical plane. Like the new building being built downtown, you got to dig deep to set a foundation so that it can be strong. So here we need to dig deep.
Sir, can you put the microphone a little closer?
Oh, I'm sorry.
Thank you.
Here we need to dig deep and set a strong foundation for this service that I foresee to go into the future another 41 years, to where when I'm old enough, I can't wait to get into it, where people may move here to actually get involved with this service. I'd like to see more services added to the program in certain ways. I don't know specifically, but I'm sure there could be more research done with that. Chicago voted us one of the #1 cities in America to retire in. The baby boomers are already here, and there are more coming. So I'd like to be able to have be ready. So in 3 years from now, we don't say, man, we wish we had that $750,000. We can handle more, expand, do advertising, like someone else had mentioned earlier. Strengthen the bonds with our community. Some of us may have missed out on our childhood, but now is a perfect time for us to embrace our adulthood, be mature, powerful, and loving to our foremothers and forefathers that have created the world we have, and the blessings. So I'd say go think for the long term and build a strong foundation. It's like a road. The re-rod is under the road. That's what our elders have laid down for us. The road is crumbled, it's down. Let's pour a new road on top that we can ride on for years and protect. And wages. I'd like to add wages. If you could, if you put it up to $15, $20 an hour, you'd have a flood. I'd like to see a line of people that want to work for the Commission on Aging, I myself included. So better wages, better training, better services, more support, then that just adds momentum, and then that continues on. And thank you very much.
Thank you. Anybody else? Joanne? Okay.
I just want to be brief. Joanne Tuck, West Curry Drive, Traverse City, Michigan. And I just wanted to mention the part about how the seniors appreciate the services and even the programs that the Commission on Aging puts together. One is the NMC barbecue meals. I've been fortunate enough to be able to deliver to those homes where they're homebound and can't get out. And the joy that's on their face just to get a meal, just to see a face come to their house. Let alone the other donations that come from the community that they put together, like the Valentine's from the Haggerty that they put together, and the volunteers that came and delivered. So there's a lot of other things besides home health, home chore, and home health aid that the Commission on Aging does. And I'm very proud to be able to help volunteer for them, and would hope that this continues. Thank you.
Thank you. Anybody else? Once, twice. There will be another chance at the end. Oh, yes, ma'am.
Can you pull the microphone down to you? Thank you.
I would like to say that I know, Muriel Makowski, Front Street, Traverse City. I'm at a loss for words here because I know the Commission on Aging has been doing a wonderful job, and how all those employees take so seriously that it's like their family they're taking care of. My nephew works for them, and I can't tell you how he looks after them and does extra little things that old people just can't do. And it means so much for them, so that I know Emily that spoke. My nephew spoke so highly of her. She, every month, talked to the whole group and explained pretty much what I think HEPA represents. But she laid out what was necessary for them to do their work and be in compliance with the work that they do. So the employees that work there, I can't speak more highly of, so thank you.
Excuse me.
Thank you.
Before you leave, I spoke to you before the meeting, and you mentioned something about wait lists.
Yes, that's another thing. I called once to see how far down the list I was, and they said, well, we don't do it like that. But I have been waiting for 3 years for lawn service. I have had Meals on Wheels when my husband was ill, and I had help at the house, in the house when he was ill. But it's really the lawn service that I can't do by myself.
Thank you.
Thank you.
Thank you. Anybody else? Yes, ma'am?
Cindy Cott, 4441 West Daisy Lane, Traverse City. I'm homemaker aide for the Commission on Aging. Been there approximately 8 years. And the bottom line is, we do what we do because we absolutely love these seniors. I've been cleaning for 20 plus years. I've cleaned at Munson, private cleaning, and I'm still there now, just because we love these seniors. And that's what makes us stand out as our own entity. That's why people know us so well. We've worked hard to build and establish what we have. And we love our seniors, bottom line.
Thank you. Sorry about that. Anybody else? Once? Twice? There will be another chance at the end. 3 times. Okay, so we'll close public comment for now. So the discussion, I think, will change from what it might have been. Being that Comfort Keepers would like not to be considered for this contract. But I believe Jen has a presentation. I looked through it. It's a lot of really good information, if you wouldn't mind. Yes, sir.
Yeah, I was going to start, if that's okay.
Go right ahead.
Madam Chair, and I know you don't want me to talk. I don't sound very good.
I was under the impression you weren't feeling all that well.
Yeah, I did. I'm fighting a bad cold, and the cold right now is ahead 10 to 1, I think. But so I apologize for my voice. But the
Commissioner Wheelock apologizes.
I apologize.
Okay.
We have been asked to prepare an overview for this work session, and I think that the overview will give you a good overview of things in totality, the millage that was passed and what it allows us to do, the organizational chart for clarity, a review of the service delivery system and the population that we serve, and budget expenditures versus the actual expenditures by cost center, and of course the client served is around 1,763, And then we'd like to review the purpose of the quality assessment panel and the findings that came out of that process and the action that had been taken originally, some of the initial steps we took as a result of the panel findings, and then discuss some of the options for going forward and would hopefully get some direction for next steps from the board at that point. So I'll turn it over to Jen. Thank you very much.
I have a question before we get started.
Yes, ma'am.
We were given materials that consisted of just a boatload of memos, and then tonight we get this. Why are we just now getting this when we could have been digesting this and been prepared for a study session?
It's a great question, and this was prepared in response to the questions that were brought up last Wednesday at the meeting, at the board meeting, and then also some additional information to provide you. It takes a while to get the information, to digest it, to put it together. We'll walk through it, slide by slide, and I'm happy to answer any questions about it.
Well, I appreciate your walking through it, but I mean, it could have been given to us earlier today even, couldn't it?
Actually, it was just finalized late this afternoon.
I see. Well, I guess I would just put on the record for future study sessions, if you're going to give me a pile of material, I'd like a chance to be able to read it, formulate thoughts and concerns. It's difficult to do that in the midst of a presentation.
Okay. Go ahead, Jen.
All right, thank you. Is it that?
I think it fell asleep.
I have those days.
Today?
Maybe you shut the TVs off. Little red lines up, it shouldn't have.
I do just want to say that I'm really pleased with the turnout here. I think it's great that such a large number of individuals are concerned about the Commission on Aging and what we're talking about with the Commission on Aging.
May I state one thing? I got sick yesterday afternoon and had to leave around 4:30, and I couldn't work with Jen, and then I had to go to the doctor this morning, and so I wasn't able to go through the draft, so it's probably my fault that it wasn't done earlier, so I'll take responsibility for that.
But one of the things we've done is we've worked to anticipate your questions and to answer those that have been already provided. And, I couldn't agree more with the concerns that have been brought up here today, and hopefully some of this additional information will provide some clarity. If we flip to this next slide, Commissioner Mayer, you had asked specifically regarding the ballot language that was presented to the voters during the election. And I anticipate that you had two questions related to that. And the first was, what does specifically the millage provide for? And underlined in that first paragraph is to provide in-home services to senior citizens aged 60 years and older. And that truly is what those dollars are authorized to spend. I think the other question that you might have been thinking about, and again, as I try and anticipate questions, is does the millage question answer how those services have to be provided? And it does not. Any ballot question would be really prohibitive if it were to define how a service were to be provided. So within this ballot language, there is no definition of how it is to be provided. And again, I don't know if that was your specific question, but those were the two things that came out.
Well, that wasn't my specific question, but at that point in history, people assumed it was going to be Commission on Aging employees, I believe. I don't think there was any information that there was any alternative to that.
Are we asking questions as we go along? Or?
I think
I'm happy
if that's
to do
okay
that.
with you,
Yeah, that
Jen,
sounds great.
Then I think that as we go along, you can bring up questions.
I have a question.
Yes, ma'am.
So based on what we heard from one of the workers, then in-home services is a term of art, and it does, although in-home services is not defined in the millage language itself, in-home services is a term of art. In-home services means things that will allow a senior to remain in their home. Correct?
We could interpret it that way. I think we could interpret it extremely strictly, or we could have a more liberal approach to interpreting it. And I actually have just a couple of slides in here about the current services that are provided, and there may be some dialogue about whether or not those meet those in-home standards of keeping people in their homes. This next slide is just an overview of kind of the current structure of the Commission on Aging. As you'll see, the Board of Commissioners, the County Administrator, and then a Director position. And I do just want to provide an update on that. We have made an offer to a Director. The background checks have been ongoing. The offer was accepted, and I hope to finalize and identify a start date with that candidate within the next day or so. So that has been ongoing. We've been working through that.
What's the job they're going to be doing? What did you offer them?
The COA Director position.
So you anticipate there being a COA Director?
Correct. Yep. And this also does show the COA Advisory Board that was established by the Board of Commissioners last year. That recruitment will begin in the first quarter of 2017. One of the things we did want to make sure that we had in place was the Director position. So that is ongoing. Then you'll see that there are two programs, there's a program supervisor and an RN, and then some additional staff below that. It consists of, there's a summary in that upper left-hand corner of 9 administrative personnel, 10 homemakers, 6 universal aides, 7 home health care, 1 foot care, and 6 home chore staff members. The ratio is 9 administrative or supervision staff to 30 there's 30 direct care personnel. So just something to be aware of as we go through this. This is, I call them kind of the COA direct client care services, and these are the ones that we've been talking about and that have raised some of the biggest questions, which is the home health care, which are the CNAs, and the COA is to be commended for having that requirement of being a CNA certified staff member. That includes, washing and bandaging and providing other personal health care services to clients. We also have respite and community living services, which are meant to provide families and caretakers with breaks in providing care to their loved ones, and those are done in 2 to 4 hour blocks of time. We also have foot care, which is often a foregone service that is greatly needed in the senior community, as your feet are your mobility. They are very important. We also have our homemaker services, which is your house cleaning services, and then also your home chore, which are lawn, snow, and odd jobs. When I look at this and I think about, Commissioner Follett, your question, what is in-home services? What are the other unmet needs that we could do? Are we partnering with other areas in other regions? And how can we enhance those services? So as we've kind of gone through this process, those have been some of the things we've been thinking about.
What of these services really dive into HIPAA? Just the home health care? And do all of the home health care services go into HIPAA?
So that's a really interesting question, because there's a bridging between all of these services, and especially when we talk about senior care. We may have an individual who goes into a home who's providing homemaking services, and notices that an individual has has signs of dementia or something like that, or is furniture surfing, and so that individual may make a mention to someone else that's going on. The issue is when we do our first assessment, we ask health questions. So whether it's a homemaker position or a homemaker service or a home chore service, anything, that information is immediately gathered. I will point out the subcontractor tonight knows information about clients. That would be a HIPAA violation unless there are policies and procedures in place in order to protect that client's confidentiality.
But I guess I don't follow some of that logic, where if you have somebody there going as a homemaker or whatever, and they see something, I don't see that logic into going into HIPAA, because that's no different than if you saw them in public, I guess.
Well, and HIPAA would actually forbid you from recognizing them as a client of the COA out in the public, as would a confidentiality policy.
Yeah, but I guess what I'm saying is, if you go into a home and you're going to go, say, do some cleaning or whatever, and you see something there, I guess I don't see that correlation as to what you see there. If you don't have, I don't know, maybe I'm not explaining myself right. What you see there, as far as if you've seen something that you thought was medical, but how is that really wrapped into HIPAA if you're not?
And maybe it's more about the
probably more of a legal question than.
And maybe it's more about the importance of that individual having an understanding of what the client's needs are. so that they can best serve them. Does that help?
Yeah, and I guess what I'm trying to figure out is exactly how many of the services do we provide where HIPAA is prominent? And, because it looks like the majority of the things we do obviously are not any HIPAA issues, but.
Maybe our council could answer that.
HIPAA would only come into play when we're talking about information. So a Commission on Aging worker gets health information, okay, jots down or documents health issues related to a client. Then the privacy rules are going to kick in, which basically say you cannot disclose that information without the consent of the individual. That's where HIPAA is going to come into play.
But I think the point about that, though, is, Chris, is just because that person has the information. I recently spoke with a lady who is a nurse practitioner that's involved in a public health clinic. She said they do a lot of their same types of things with volunteers and untrained personnel, and they handle it strictly by a confidentiality agreement.
Right.
And they're fully compliant by making sure that all of the people that Grand Traverse County puts in contact with these people have understood and have signed a confidentiality agreement.
Probably have some training that goes with that, too.
I've been around this block a little while, and, we talk about things like respite care. I was probably the biggest reason Grand Traverse COA got involved in respite care when I was making ambulance calls, because all of a sudden I'd make a call to someplace, and I couldn't take the patient out of the home because their dementia, inflicted family member was in the house. There was not another caregiver for them. So we literally leave an EMT or we leave a police officer there to babysit that person until someone else can actually come, in fact, to stay with them. That sounds real easy, but sometimes it's not. And sometimes that we don't have that time. We need to load and go and get out of here right now for the safety of the patient. And yet we're dealing with having to deal with, okay, we got to get this other person, we got to get them around, we can get them dressed, we can take them with us, then we take them to the emergency room, then somebody has to stay with them. That became a real problem, and that's why the respite care program was started a few years ago. Quite a few years ago now. But I think the important thing is we provide many, many services that are not medically related, but at the same time, obviously with the interaction with these people, someone may witness something that may be whether it's a dementia state, that their medication is laying on the table and it doesn't appear that they've taken it, whatever the situation is. But we can deal with that strictly with a confidentiality agreement. We don't have to throw away the whole process to deal with that. We can secure the personal information of that patient or that client without having to go through a whole nother process. We just simply have to make sure that we have the right confidentiality agreements in place. That's strictly an administrative function. We can do that.
So, I have a clarification kind of question, maybe not even a question, but, so in your example, someone's going to go do some home chores for someone and they notice that they're acting odd or that they're doing something they didn't do before or something. I understand where that person shouldn't go home and tell their husband, geez, Mary Sue was acting really weird today and I don't know what's going on with her. And I think they understand that they're not to do that, but they are still obligated to tell the nurse supervisor, hey, this was really weird, or, and how does HIPAA differ in that?
And maybe my explanation wasn't very good on that. But it's really in the continuity of services. It's allowing that individual to have the information so that they know if Mrs. Smith, doesn't remember things, or because she has Alzheimer's, they can create an alternative plan for providing, that, writing it down in a journal or in a log and doing that. And so it allows a better level of care for an individual.
But it's not the fact that you have that information as much as you need to make sure that that person has been trained in HIPAA policies and procedures, that they're not divulging the information.
I think it's important to share that information, though.
And that's allowable. Yeah. As long as everybody is trained under HIPAA compliance, I would think that would be allowed
as long as we understand our confidentiality issues.
Okay.
This is kind of some of the other services that are provided at this COA. I'm calling them client support services. they provide a personal emergency response system, which is your emergency call system. They have a MedMinder program, which is a box, which is quite neat. One of the challenges with the MedMinder program is that we are able to provide the box, but there's nobody there to assist the senior with filling it with medications, and that is a significant need in the community. And it does take an RN to be able to do that. Some of the other support services are the home chore vouchers. I heard a concern regarding a wait list for lawn care. We do have vouchers that are available that can be purchased at a reduced cost based on income, where there are private contractors that are available to provide those services. We have transportation vouchers. We have backup and vacation services, and then also the NMC barbecue, the baskets of bounty, the COA partners with the AARP, and then there are various other outreach activities. And then, again, as we go through this, it's important to think about, what are the other needs in our community? Are there needs for dental needs? Are there orthotic needs? Something to keep in mind. Anything on that one? This one is an interesting slide to me. This looks at our population in Grand Traverse County, which we're approaching about 90,000, and then our population over the age of 60, which is the population that's eligible to be served by the COA. And that number, as of the 2015 fact finder, is 20,894. And in 2016, we served through the COA 1,787 individuals, which amounts to about 8.5% of the senior population here in Grand Traverse County. One of the questions regarding this data is, so who are we missing, and why aren't we serving them? Do they know about our services? And how can we bring together the information that we have with other providers so that we can truly understand the senior health and the senior health needs of that population?
Well, and I think
Did you just say health?
Health.
And how are you defining health? Because, again, so much of this is not related to health. It's related to services to help people stay in their homes. And I think it's important to make that distinction because we're not focusing on health. We're focusing on services that will allow seniors to remain in their homes. Health services are actually provided through medical providers. So I think it's important that we use the language carefully.
When I think of health, I think of the emotional, physical, and the mental health of a senior citizen and how that works collectively. And so that includes, both their home living as well as their physical health. And I think all of those things kind of combine together into that term.
I would agree with that definition, but I just want to make sure we're on the same page.
Absolutely.
Okay, thanks.
And we do provide many home services that are truly not health-related in basis. And I think if we have a shortfall, I've talked to hundreds of clients that are very, very pleased with the services that they receive. Very, very few, probably maybe 3 or 4 in the 20 years I've sat in this chair, that are unhappy with the service that they received. I've talked to hundreds of people throughout the community that vote for these millages, and they trust the fact that we're providing the services to our community. And they're happy about the fact that we're providing that service. And they obviously think we're doing a good job of providing that service, or else they wouldn't continue to vote 80% to renew the millages. So I think if there's one place that we maybe need to talk about whether or not we have a shortfall, it's on some of the services like Ms. Mikowski talked about. Those whether we're meeting the needs for the lawn services, the home care. I spoke with a lady a while back that had been on a list for an extended length of time waiting for someone to come install a handicap assist rail in her shower because she was concerned that she was going to fall. Well, what can we do to expand those services? And those are huge services that are needed in our community, and there's no reason that we can't figure out a way to provide those. We've talked about it, over the years. I've had a lot of complaints about some of the things that we do when we put 2 guys in a truck and drive out to Fife Lake to plow a driveway. It doesn't make any sense. We should figure out some way that we can contract with a vendor with the voucher system or something to provide those services. Those are not necessarily services that make sense for us to put 2 county employees in a county-owned vehicle and drive to Fife Lake to plow a driveway. It doesn't make any sense. But We've looked at the snowplow routes. Is there a way that we would want to do vouchers or contract some of those services? We're truly not, we're not in the business of providing snowplow services. Not to say that we can't do it, because we can, but are we doing it efficiently and cost effectively? That's the question.
Dan, yes.
The advisory committee looked at COA and came up with a lot of concerns. Are we going to get to those concerns in your talk today?
Yes, I have those. I just wanted to give you some overview and some background information.
Because the issue that concerns administration, after deep study of this, isn't whether or not people are satisfied with their services. It's other things. Am I correct?
That is correct.
It's all administration. It's not service.
Okay, so a lot of our citizens and a lot of our workers are saying that they're afraid that the connection between the workers and the people that they work for, the services, all that kind of stuff, they're afraid they're going to lose all that. We're not talking about that, are we?
Correct.
Okay, so that's what I want to put people's minds at ease, is that we're not saying they weren't giving good service. And we're not saying that they didn't love each other and that it didn't work well. There are administrative things that may need to be changed. Is that true?
Correct, yes.
Okay, I want to frame that idea as we go forward.
So
Thank
you're
you.
exactly
It's a
correct.
good summary.
I thought that same thing. When I read all the memos and everything that you gave us, I reread everything, and I saw no reason to question the quality of service that we're giving at all. There was no question that it's excellent quality of service. There are some behind-the-scenes issues of administration and making sure that all the Ts are crossed and all the Is are dotted that we need to take care of and figure out how to get those taken care of.
Correct.
Right.
Yeah.
Okay.
About a year ago or so, the foot care people, I offered to work with them. And they came into my office. You know what? They didn't need my help. They were really good. And so my experience and my patients that are treated by our employees, I never hear a complaint. So I don't think that's the issue. Okay.
Tom, did you have a comment?
Well, I just want to preface the whole study session with that this department is self-funded. They have a fund balance, and they passed a millage, and people expected to go on as normal, and that this budget does not come out of the general budget of the county. Doesn't have anything to do with it. Just to let you know that, separate.
Thank you.
Yeah, I appreciate the clarification that we're really looking at those administrative and management issues that have come to the forefront.
A lot of things are brought up. I'm glad they were brought up, but that's not the issue.
Correct.
Okay.
Correct.
Okay.
Yeah, and Sonny, to your point, some of the things we've been batting around is there a way where we can leverage the buying power of the COA so that, clients can get vouchers that are locked in at a certain rate, so they're not all paying different ones, and so there's a standard, so somebody's not paying 20 when somebody's else is paying 10 for those client services. So those are all things that we're continuing to think about and look at. This next slide just talks a little bit more in depth about the clients that were served in 2016. You've got, in those 5 direct care services program, you have 1,326 individual clients. Many of these clients receive duplicate services or multiple services across programs. The chart goes into breakdown, the hours of service, the average hours per client per year. You'll see that the respite program, as well as the home health program, are the most highly, in terms of hours utilized per client per year. And it goes across to talk about the budgeted expenditures, as well as the average cost per client. And then it breaks it down to the average cost per hour. You can see those numbers in the right-hand column. And that's based on an all-in cost. That's administrative costs, that's the other costs, that's direct care costs. I did a brief comparison there looking at the total compensation of a COA direct care staff member, and I used an average hourly rate of about $15, of $15. And then added in their paid time off, their FICA, the short and long-term disability, the life insurance costs, the health costs, the defined compensation or their retirement program, and their workers' compensation that's received. And it comes out to a total compensation of $46,751 per year for an individual making the $15 rate. That cost per hour is $23.98. So when I look at that $23.98 and then I look over to that average cost per hour, and you'll see under respite, it's $44.68. On foot care, it's $87.69. And under home health, it's $68.22. And from an administrative perspective, I ask the question of why is it so much higher? What are those costs that we're incurring that are doubling, sometimes tripling that amount of the cost? So that's something that we want to continue to keep in mind and look at. Any questions about that? All right. This next slide, this is what the budget looks like when it's adopted. And in this slide, there's that administration. It's the second set of bars there from the left. And that shows an administration budget of $207,383 in 2017. And that would have been the adopted budget.
I think, did you have a comment or a question? I'll allow a question.
Back to the cost per hour.
Did you have a question on that, or?
I just wanted to advise you guys that the cost of that she's saying is the 6840 also has all of the administrative office.
Right, she did clarify that at the beginning. Yes, thank you, though. Thank you.
So, yeah, this slide is showing $200,000. Now, what's really interesting is when you start on the next slide, the budget hasn't been presented to the board in a clear and transparent way for a number of years. What we like to call this is, we're kind of baking in the administrative costs into the personnel line items of program budgets. It's been done for a number of years. It's been the pattern. One of the things that should have been done is these administrative costs should have come out of an administrative line item so that you could easily see what it costs to administer the program. That's not what happened. So this shows, after we pull all of those administrative costs out of the budgets, of the various program budgets, your administrative costs are $600,588 in 2017.
Administrative costs for COA?
For COA.
Where is that?
It's on page 10,
Oh, I'm not.
the second bar.
Gotcha.
So
I'm assuming that that's taking a whole lot of line items throughout the budget and bunching them all into administration to come to that number.
No, sir, that is just the administrative staff costs for those 9 personnel, plus a little bit of supply, about $40,000 that was included in the administrative budget.
So you said in the COA, we have 30 personnel that are not administrative.
No, we have nine that are administrative and 30 that are not.
Well, okay, 9 that are administrative.
Correct.
And 30 that are not, 39 total.
Correct.
Okay, so these 9 people cost us $600,000?
$569,614.
But does that include the director's salary?
It includes the directors as well as all the
And-
fringe benefits.
Okay.
Oh, and all the fringes, so
The
it
deputy
includes all this
director are
stuff.
now the,
Operations analyst.
And the RN, and
it's
the
also
people with,
gonna
the people with
include the IT
credentials, the
costs that we
nurses,
charge.
the, people who have degrees and
Yes.
education and training.
Well, I'm
Okay.
assuming it's also
So-
including all the IT costs and the indirect costs that the county bills back.
No, sir. Those are still,
Where are those?
those are still littered throughout all of the programs. Can I flip to the next slide, and I think I might start to answer some of your questions?
Okay.
So this one is, I think, where did it go?
Right there.
Oh, okay, so I can explain this. And you have the numbers on your slides, I believe. The bottom red part there is the direct care staff cost. That is for the cost of the field staff that go out and that actually touch their clients. That amount is $1.39 million, which amounts to 50% of the annual COA budget. That right-hand corner orange piece of the pie is your administrative costs, which is the 569, and that's personnel only. And that amounts to 21% of your budget. Then there are these other costs. Sonny, you mentioned, indirect costs, what's our rent, our utilities, our supplies, equipment, phones, travel, mileage. All of those amount to $794,000, which is about 29% of the budget. So you have 50% of the dollars that are spent are actually touching the clients of the COA and our senior citizens. Again, from an administrative standpoint, I start to ask the question, is that acceptable? Or should we be shooting for a higher rate that's actually touching the clients?
What does our pie chart look like for the county?
I believe
What are our administrative costs, including, all of our administrators of all of the departments and their benefits and their extra packages? What part of the salary does that equal?
we could certainly provide that information to you, but I don't have it available today.
Would you be stunned if it was 21%?
I don't know. I would hate to.
I wouldn't be.
Okay.
I have a question. Where does training come in here? Is that other?
It would be another cost, yes.
Other?
Yep,
So the training is over there?
yes.
Okay.
But I believe that amounted to just shy of about $5,000.
Okay, so training and certification and anything like that is
Been woefully
all in
underfunded,
there.
yes.
Do we have other county departments that have 30 people that are working and 9 people that are administrating them?
I'm sure.
We've got county departments that are all administrative.
Yeah, I don't know that there's any county departments that would mirror, this is a special.
Right.
It's pretty labor-intensive thing.
Well, I just wondered. 'cause-
Yeah,
I think it's a good question.
No, I was thinking the same thing, but I was also thinking that would be something for the director to look into.
Yeah.
When whenever the new director comes in, because that, to me, I'm not gonna micromanage the department, but it does sound like a lot of administrative staff, but there's a lot of behind-the-scenes work that goes on with scheduling probably and everything else.
And supervision.
So, I mean,
And nurses.
So,
I think
Yes, sir.
standard in business used to be like 1 to 5 reporting relationship was about as much as you'd want, I suppose if it's, depending on the function, but if it's direct reports, 1 to 5 working every day, that's usually the ratio that they use for that.
I'm not surprised by the 50% cost to actually the on-the-ground cost. That doesn't surprise me. I'm a little surprised that the administration portion is quite as high as it is, but it's,
Sonny, I just did the math, and 9 people divided by that number is $63,229 for salary and benefits. How is that out of the ballpark?
That's out of line.
I mean, I think
and
the
if you were
bigger,
to look at, if you're looking at nonprofits to donate to, because I look at that stuff before I donate, that's in line with some of the top ones as far as administrative costs. So,
Yes, Dan?
I don't know if that's the point. Certainly those people with their degrees could be worth that kind of money, but do you need that many people
I agree.
to manage
I
30
agree.
people?
I
That's a
agree.
fair
If
question.
that's the- And if that's the point, that's a
Yeah.
good point, but by putting a
In
dollar
public
figure
comment,
on
we
it,
can.
it
We can take
skews what the
questions,
point is.
but-
Exactly, yeah.
Okay.
I can ask a question?
You can ask a question,
So are all of
but you
those
need to
nine-
step up to the, you can
so
ask a
are all
question.
of those 9 supervisory people, those administration people supervisory?
No, they are not.
Thank you.
Thank you.
They're administrative staff and supervision staff. So it's a combination.
They're not.
They're not
So the
directly-
difference is that they don't go out into the field,
There are some cases in which there are assessments that are done, so they do go out into the
but they
field.
don't provide direct service to clients.
Sure they do if they go out.
Or do
Yeah,
they?
they do when they go out in the field. But it's considered, they're doing it in an administrative capacity, so they're not
Okay.
responsible for ongoing care of the client.
Can you come up to the microphone?
Yeah, you got to come to microphone. I'll let you ask one more question.
I just want her to please clarify how many of those administrative staff directly supervise other staff?
Okay.
I don't know if that's really important right now for the
It is when
discussion.
you're saying that there's a ratio.
Oh, okay.
But for what we're discussing, I don't think that's really of vital importance right now. I mean, I don't want to
Do you
shut
have
you
an
down, but
answer, or?
Well, I would just
maybe
refer to the
just-
organizational chart that was included
Okay,
on.
okay, fair enough.
I'll tell you what that is.
Yeah, slide number 4.
Okay. All right, we can move on.
Excellent. This slide, this is kind of blending the conversation we've been having about, hours of service and expenditures. And on the left-hand side, you'll see those are the hours of service by each one of those 5 core areas that we've been talking about. And 3 out of the 5 actually show a decrease in the hours of service. Respite shows an increase in the hours of service, and foot care is generally flat. When you look over to the right-hand chart there, you'll note that the expenditures are actually going down in 2 of those areas, and they're going up in the other areas. So when I look at this, I go, are we really meeting the need? Are we meeting the need of the clients that we serve? Should we be serving more people? Do we need to be getting out more? Do we need to be promoting our services? Do we need to be enhancing our services to meet different needs? We just don't know, and we don't have the data, and we don't have the information, because it's something that hasn't been looked at. We've been status quo with the type of service that we provide at the COA for quite a number of years. So I think this is an excellent opportunity to look at how we can improve those services.
Jen, in the charts that you put together here, the COA, they have contract with Comfort Keepers for some time to provide some care when there was not enough staff to take care of. Where does that fall into any of your charts where?
Those hours of service are included.
That'd be other services.
In terms of the contracted amount?
In terms of.
Your little pie chart.
There's times where Comfort Keepers sends staff out.
Mm-hmm.
Is that other services? Is that what?
Those costs would be included in other services, yes.
Okay.
No, the services
But they
are
are
direct
very,
care.
it is a very nominal amount. I want to say approximately $10,000 per year in terms of those costs. So, but those aren't us actually, as a COA, touching the clients.
Okay.
Well, one thing that as I look at this new chart, and it talks about the uptick, if you will, in respite care, when I go back to one of the previous charts, we have to remember that our individual clients have individual needs, so when we look at respite care, we have 139 clients that were served in 2016 for respite needs, for an average client usage of 59 hours a year. So that's a big piece, and it's reflected in the fact that it's $363,000. So we spent $363,000, almost $364,000, providing respite care for 140 people. An important service, and but not unlike all the other budget discussions we have to look at what services we're providing, how much that service costs, and how many people are being served by it. I think respite care is very important, but it also comes with a big price tag. So we need to, talk about that too somewhere along the way.
This just talks a little bit more just the cost per hour of service, and just gives you a visual representation of the information that we talked about. I'll keep moving along here. This is just kind of, again, showing the administrative costs that are baked within each one of these budgets. When I look at something like this, I start to ask the question as to whether or not there should be economies of scale, and so whether or not these administrative costs should be less, because they are spread out throughout the program and they should be an efficient process. So that's kind of the background information that I wanted to provide, and the additional new information. This is just a brief summary, and I have a few slides to talk about the Quality Assessment Panel, and why it was formed, and what we wanted to do with it, and some of the things that have occurred from it. This started back in August of 2016, and it was a result of a reorganization plan was charged to be completed back in 2015, and as of this time, it had not been completed. There were also some discussions going on within the COA itself as to whether or not it should form an authority or relocate or become an independent entity of some sort, and that was creating angst. It was creating angst in the COA community. And we were hearing different stories, and there were all kinds of different things going on. We had staff members that were lobbying board members for salary increases. We had an issue regarding the licenses and supervision of the CNA staff. And we had a host of staff-related employee issues regarding leadership and supervision. And so All of those issues combined were a red flag and multiple red flags to us, and county administration then formed the quality assessment panel to begin to look at those issues.
And Jen, just so that we're clear, if I'm remembering history correctly, there was no director for about 18 months, and there was no nurse. The nurse had just resigned her position. So those two primary leaders of the organization being missing, wouldn't that by itself create a significant amount of distress within the organization?
I would believe that the lack of leadership would, yes.
The lack of leadership.
Yes.
So I appreciate these other things, but when you don't have any leadership...
There was a deputy director there too, though, so, I mean...
A very short-term deputy director, though, isn't that correct?
No.
Wasn't she a fairly new hire?
I don't know the date.
But she was there the whole time, so...
No, they weren't completely adrift, I will grant you that.
Yeah, so, I mean...
But
And I guess that's what I want to make sure is, they weren't just, treading water.
It wasn't like our HR department, no, it's really a little different, so, yeah.
Okay.
So,
Go on, Jen, please.
The QAP took on a pretty extensive process. One of them was we wanted to make sure that we involved employees, and so we held focus groups. We met, we invited staff. We didn't ask their names. They weren't mandatory meetings. In fact, we paid them overtime if they were overtime. But we really wanted to have a clear, honest, and frank discussion. There were, no notes taken related to who said what and why. We just wanted the feedback. And we got a lot of feedback, and a lot of that has formulated some of the issues and some of the things that we've been working on at the COA and some of the policy issues that we came up with. The QAP got together, we reviewed the current services, the staffing structures, the budget, the client caseload, and the COA policies and procedures. And
I think, did Tom have,
Oh,
can
I'm
we
sorry.
pause if we're going to be between
back-
slides for Tom here?
Back to the rationale slide. One of the things, I just wondered what our standard for best practices is, because I've been reading about that lately. And is it mostly our own idea of what best practices are? Is it based on experience? Is that sort of where you derive the best practices from? Like you have these experiences over this amount of time, and you learn from that, and then you develop best practices? Is that how you explain it?
In the in-home healthcare industry, there are best practices related to client care, as well as to client interaction, to client feedback and surveying, as well as medical healthcare processes or procedures that are performed. There are standards of care that go along with that and can be a guide for that.
Yeah, I'd like some more information later on where you go to find out what your standard is.
Yep.
Yeah.
Certification.
And I think the other part of that is we would look at us as a region, as how can we work, with the other senior service agencies in our region. What are they doing? What are they measuring? How are they doing the processes?
That's the experience part.
Yeah. Yep. And then how do we compare? And then how do we take that information and look at the community, senior health, physical, mental, and emotional together, and where are the gaps in that?
Right. Okay, so just for me, because I hear people say best practices in terms like that, but I just want to know where they come from, like a source, I guess,
Okay.
All right. So we talk about the findings of the QAP. I think there were some significant and some more significant than others. I think, though, they all have significance when we're talking about our senior citizens. The first one was that we had non-medically trained staff who were supervising healthcare staff. That was a significant concern. That had happened, actually. There had been a gap in when the individual who put in their notice and when the position was posted, and that was a leadership decision, which was unfortunate. That should have been posted immediately when that position, we were notified that there was going to be a vacancy. Just to provide some clarification regarding that, we did enter into the interview process for that position early on. We had a candidate who withdrew from consideration. And we eventually reached a point where we needed to seek out a contractor to provide those services, especially with the work of the QAP going on. So as soon as we found out that there was a problem, we did work to solve it. That was something that county administration, the QAP, was committed to doing.
I want to bring up something, go back a notch. We've got COA staff who are lobbying COA board members for salary increases. I actually was lobbied for a salary increase. people working for COA. So it wasn't just, when you say COA board, this board got lobbied too. Okay.
It's an unfortunate and a very challenging position to be put in. So we did want to nip that one in the bud. After we identified the need for the healthcare supervision, the COA actually went in and entered into an invalid agreement in an attempt to solve the problem on their own with the pavilions. There was a conflict of interest with this agreement, as one of the board members on the COA was also the signatory for the provider, and so that was an invalid contract and again placed us at risk. Again, we've since resolved that issue, but the poor decision-making was a challenge for all of us going through that process. So we currently do now have the appropriate supervision in place. We've talked a little bit about the HIPAA compliant. That is a significant issue. And I won't beat that one to death anymore, but we do need to become HIPAA compliant. It is a standard of care that is a higher level of care than perhaps what we may wish to accept. So I guess my question to you, if HIPAA isn't important, are we going to accept a lower standard of patient confidentiality?
Can I make a clarification? I think when we talk about standard of care, again, the words matter as far as when you're talking about HIPAA and the HIPAA standards, that's different than the standard of care. And so I think that we do need to make a distinction that the care is not in question. It's the administration of a policy or that we have to follow that isn't quite there. And that's not I wouldn't call that a standard of care. I would call that a standard of administration. That's a standard that we have to meet, but it's not a standard of care that we have to meet, because the care that's being provided is excellent. There maybe is a gap with the understanding HIPAA and being completely compliant with a law as far as that. But I don't know that that really qualifies as a standard of care, that we're accepting a lower standard of care because we may not be completely HIPAA compliant at the moment.
Well, I think the situation is it has nothing to do with the standard of care to the patient.
Right.
It has to do with the administrative standard that we're probably not meeting. And if I understood Mr. Forsythe a week or so ago, the comment was made that, we have to acknowledge that, which I think is why we're here this evening, and we have to develop a plan by which we will become HIPAA compliant, And, I think that's the key piece of that is, it is an administrative responsibility, and, it is important, but we can create a plan for it. And I know Wendy and I have had this discussion a couple times.
And Wendy would like to have a moment in the sun, and that's fine.
I don't know that I'm dying to talk about it, but
I know, well.
but I will.
You may.
All right.
Thank you.
So Wendy Trout, Health Officer for Grand Traverse County Health Department. We are what's considered a hybrid organization under HIPAA law. So some of our programs must meet the HIPAA compliance and some don't. So animal control, medical examiner, a lot of our environmental health, those things don't fall under the HIPAA umbrella, but they are part of the health department umbrella. So as an entity, we as a whole embrace HIPAA. So I just want to talk a little bit about what it kind of takes to be compliant. If you handle protected health information, I understand that not everything Commission on Aging does is protected health information, but you need to protect the privacy and the security of it. And it gets a little complicated once you start diving into what does that really mean. So that's really what all this is about, and what it takes as an organization. So there's 4 main HIPAA rules that you have to ensure. There's a privacy rule, an enforcement rule, a security rule, and a breach notification rule. So for us, and this is our experience at the health department, when we talk about the HIPAA policy, our manual is this big, and it actually is 30 separate policies, which are solely based on how we operate as an entity. So it's not just one, it's numerous policies. It guides our work processes, how our programs, the procedures, and our daily operations. There's also comprehensive forms for clients and how they can request protected information and release of records. We have mandatory education that is built into our staff meetings, but it's also built into the daily, just through our daily policies and procedures. We have a designated HIPAA compliance officer, and this person's responsible to ensure the policies, the procedures, the workflow, the workspaces. There's all kinds of assessments that you have to do, and it flows through everything that we do. So it's not just a simple policy. So for us, it's a .4 dedicated FTE who's a public health nurse, who is the officer who has that responsibility. Management and administration, of course, working in conjunction in ensuring the compliance, ensuring the training, ensuring what they need to support. There's lots of mandatory things that you have to do and you have to post. And for us, client confidentiality and the privacy was a consideration when the new building was built. When you come into the health department, you're not locked out of certain areas just because we don't want you in there. It's so that clients don't wander into areas where staff are working and things are behind locked doors, usually two sets, either locked filing cabinets and locked doors. So there's a lot goes into the design, the workflow, staff workspaces, their workstation security, and even electronic devices that they utilize for their jobs, and then building security. Any other county staff who come into the health department into those areas have to go through quick HIPAA. They have to sign a form. So that includes like IT, facilities, human resources, administration. And it's also built into our electronic health record, our electronic communications, and we have policies specific for emailing, texting, phone calls, basically everything. So kind of in a nutshell, HIPAA compliance, it's not just a policy and it's not just a computer program or one training. It's a culture that embraces the expectations and requirements for protecting health information and client confidentiality every day, every interactions, and all methods of communication. If we're in Meyer and we see somebody who's a health department client, we can't even pretend to recognize them. They recognize us and address us, that's something else. And we certainly can't talk about why they come to the health department. It's in all aspects of their lives, and it's in order to maintain the high standards and the integrity that's needed for the protection of this information. It takes a very high level of commitment from all the staff, and it's something that's built into our decision matrix for a lot of our daily operations. So we live and breathe HIPAA. That's our experience, and we have very specific things for public health and lots of different programs. I am not an expert on Commission on Aging. Won't pretend to be. So I can just share what it entails for us as a health department.
Is the training different based on the level of interaction? Like if you have somebody that comes in for, you said several other people that come in there are the county employees. I know you said IT, that might be a little different. But is there different levels of training because some person may not be so full in depth?
So
where that could be at the COA, you could get away with, not get away, but you could have that built into it to say you're only at this level because of the service you provide.
I don't know that I could say, not knowing all the days, however you choose to do this for the Commission on Aging, I'm not here to tell you how to do it. You need to have someone who's a point person who digs in because they really need to understand everything. And Commission on Aging does a lot more outside of the building. We have a lot of clinical services, and we do have some home case management services as well. So there are components. I mean, we've shared our policies, but they're not just ones that you could take and just, somebody's made a comment on our Facebook page, like, just give them your policy, just give them, it's not that simple at all.
How many people do you interact with a year, clients? Roughly?
I don't know off the top of my head, to be honest. Like in all of our divisions?
Yeah.
I don't have that off the top of my head.
We're talking about only.
It doesn't matter.
Something really,
whether
it's the home health care stuff.
But if it's 1 or 10 or 10,000, it's you're
I'm
still
trying
held
to
to the
compare,
same
you've got
standard.
.4 FTE for a HIPAA compliance officer. Would you need
need that level.
But Bob, you've got a department that is running HIV tests. You have dental practices. You have birth control issues. You have things that scream HIPAA, okay? We're talking about cleaning somebody's house and putting up their gutters, okay? So, I mean, we have a whole, I'm not saying we don't need HIPAA. We need HIPAA, but we're making this a much bigger issue than it needs to be. We get somebody to do the HIPAA, we give the training, and we move on. I mean, it is an administrative function. It is not like the health department. It is not.
I wasn't saying it
Right.
was.
No, and I'm simply reiterating, it is not. There's no correlation between what you do and what COA does on a daily basis. I'm sorry, I don't see that.
Except if
No, and I was
if there is
just gonna-
protected health
Hold on,
information,
hold on.
then they would have to
Wendy,
follow HIPAA.
My
Yeah.
question, Wendy,
Yeah.
is with the health department.
Yeah.
And you have field inspectors, I mean, septic systems, well,
Right, those aren't covered under HIPAA.
they're not,
No.
they don't have to.
No.
Okay, I'm just making sure that because if they had to go through the same training, because they were in the health department.
They have to, they do go through the training, probably not as in-depth as the clinical, and the people who do it day in and day out, because it even flows into if they're having discussions perhaps about a client, they don't talk client names when they're having those discussions.
Actually, I
So
mean, we
there's
can
just a
talk
lot
about-
of layers of confidentiality that you build in.
Okay,
Right.
but just so that I understand, they don't go through any HIPAA training or?
They go through HIPAA training because they interact with our staff
Okay.
in the main building, and if they come over to our building, they have to go through that training.
So that's where I was going is, I mean, with the COA, that would make me think that those folks that are inspecting, doing septic tank inspections, to me, they would be similar to lawnmowers with, guys going out mowing lawns.
So there's also business agreements, so we have to ensure that any vendors that we deal with through our things are HIPAA compliant, and I think that's what the Area Agency on Aging issue is with. But also, I'm sure there are some things that Commission on Aging does that is protected health information that could,
I don't think there's
Yeah.
any of us that do, believe that we don't have to do something to become HIPAA compliant. I think, it's pretty obvious that we need a HIPAA compliance officer at the Commission on Aging, whether that's a full-time position, whether it's a part-time position. I think that's all open for discussion. But I don't think there's any question we have, kind of slid through without this, and we are now at a point where we simply have to have a HIPAA compliance officer.
I agree, and I
would-
think the fact that we're actually spending this amount of time talking about whether or not it is or isn't is all the more reason that
It
you
tells
need to
you
have
that we
someone who
have to
knows,
have one.
who knows it
Obviously.
and can dig in and really figure it out.
Yes.
I have a daughter
Okay.
that deals with
Thank you,
an
Wendy.
NCAA compliance officer every day.
Okay. Can you find out where we left off?
Absolutely. So kind of moving on from there, the other thing, we identified was that there was no formal education or training program for staff. Knowing the need to invest in staff and to making sure that the skill sets are up to date and that they can have an opportunity to grow, that is something that we believe is very important and that will also positively impact our clients. That was another finding of the QAP. In 2016, there was a mandated switch for some employees to become universal aides, which led to significant or dissatisfaction amongst a number of employees. That leadership and management decision was expressed to us during our focus groups with employees, and so we found that to be a significant concern. Overall, the processes and the systems at the COA are outdated and labor-intensive. I believe that is one of the reasons why we see such high administrative costs, as well as potentially the number of staff. That was another finding. In June of 2016, an RFP was actually issued for technology for the COA. However, that was never moved ahead with to provide a recommendation to purchase the equipment or to implement it. And when I've looked at the RFP, the information that was asked for from the vendors, as well as the information that was received, didn't even allow me the ability to understand how much it was going to cost us to implement it. And so it was something that a software RFP is a detailed RFP. expressing standards and requirements, as well as schedules and simply costs of implementing it, and those were not provided in a clear and concise way. So that's something that's going to have to be pursued if you decide to move in that direction. There were COA policies that conflicted with county employment policies. Staff was being required to work on holidays, and the overtime and comp time policy were not being applied consistently. We believe that the COA employees are employees of the county, and therefore county employees' policies should apply. That was another finding. We had a number of policy issues. I'll kind of start to summarize these a little bit. Emergency services are available for some COA clients. There was no standard for that, leading to some potentially benefiting more than others. Again, there was no standard for grants. The COA issues grants and an RFP to grant funds to nonprofit agencies, and there were no standards for that. Something from an administrative perspective, there should be standards for what we're actually issuing that for and what we're getting out of it. We found that staff was spending up to 60% of their time, several staff were spending up to 60% of their time supporting the operation of the COA board. We found that there were no policies and procedures related to the provision of health care services that were being provided by the CNA staff. Even though for a number of years we had an RN supervisor on staff, we still had no written policies and procedures. There were no standards for transportation vouchers, enabling one client to receive last year over 800 vouchers. Obviously, there was a significant potential for some individuals to take advantage of the system. We found that there was a need to restructure the COA leadership and to focus the efforts and the work of the QAP. We found that we needed to recruit candidates, and we posted that position for the COA director. And we also found that it was difficult for the QAP to rely on data that was provided by the COA. Throughout the process and throughout the compilation of this report, data was updated, revised, changed, and made it difficult for consistency. So, since that work was identified, we've been continuing to make some improvements. We immediately contracted to provide an RN supervisor. We did a departmental redesign to focus on the QAP efforts. We've reviewed internal policies to make sure that the policies were consistent with the county policy. We actually enabled the employees who were mandated to move to that other position the opportunity to return to their prior classification. We conducted a wage assessment for the homemaker aides, which concluded that the positions had been classified improperly, and an adjustment was made to their salaries as of January 1st of 2017. We also, although we didn't look specifically at the home chore program, we found that there was a need through being on site to authorize some temporary staff out there to maintain services. We enabled staff to relocate their storage areas to the old animal control building, which is a better utilization of county space and facilities. Employees are no longer required to work holidays. Again, consistency with county policies. We've implemented credit and debit cards to make payments easier for clients and families. This is something that had been not implemented for a number of years, but had been available. Provides a significant benefit. Now it's just a matter of helping our clients navigate the electronic world so that they can make those payments online. We've authorized the purchase of smartphones for communication with field staff. Staff never had email addresses for the county, making communication very difficult. So we've gone ahead and we'll be issuing county email addresses, which will streamline communication. And we continue to work to identify opportunities for improvement at the COA. And there's a lot of work to be done. Any questions on that? Took a long time to actually get through some of those things, but we've made it.
I have a couple questions. I've kind of identified quite a few of the things in the summary of the QAP findings that a new director would be some of their first things that they would tackle.
There's a lot to tackle.
Right, yeah, I understand that. But I think that some of these, while Bob said it wasn't completely adrift, there have been not enough leadership there to do some of these things. So while it was, yes, go ahead.
No, you finish your thought.
So while it was operating and still providing good service, there's not opportunities for growth, there's not, the technology should have been upgraded, which is why you can't maybe get really great numbers, because it's, hard to compile. The policies conflicted with county employment policies, a direct relation of, we haven't had an HR director for a while either, so we can see where that may have lapsed in there. So I see some of it.
But that didn't
really
just
may-
pop up.
No, I know it
that didn't just pop up
up.
because
No, no.
HR is not there.
No,
So
no, I
again,
understand that.
I'm trying to,
But I'm trying to say that while services were being provided, that we really needed a COA director really badly here, and I think the new director, a lot of these things are some of the first things that they can tackle. I guess that was just an observation, that there was a few things that a new director would really help a lot of these things. Yes, Dan?
I'll bet a lot of these things, these deficiencies, existed when we had a director.
Maybe?
So the fact that we
Possible.
didn't have a director, I don't think that's the issue.
Maybe not.
When I look at the staff that was trying to save all this, I think they did a good job. Look at all the things they did.
Mm-hmm.
And so,
As I
yeah,
said,
we
they
need a
still did
director,
continue to operate, and that's
But
good.
these deficiencies existed before, when we had a director.
Quite possible. Cheryl, you had a comment?
When I was on that board and we had directors, all these things were still going on, we just didn't know about them.
Okay.
Well, and that goes to the comment that I was going to make. I guess I would say that I think that there's more than enough blame to go around. I think that the administration has blame. I think that the board has blame. I think that there was a lot that was overlooked, that was a lot of balls that were dropped. I look at a lot of these findings, and it's like, why did it take this long to find it? I mean, why wasn't there an annual or a semi-annual or a quarterly report made to this board? If it was, it wasn't structured, that this board didn't give enough direction to the COA about what we needed, because this didn't just happen overnight, and this didn't just happen since August of 2016. And I think you did great work in finding all of these things and in identifying them, and I think that they can be repaired, and I think that they can be made even better than they are. But the point is, we all are responsible, and everybody needs to take responsibility for this.
I guess that was kind of my point too, that it's good that now we know all of these things, so that this will help direct the new director to, here's what needs to be done. So that person's not going to come in and find all of this is going on and be surprised, because they have a list of the things that, yes, thank you, that helps to make my point as well. Thank you very much. Yes, Tom?
Oh, it just seems like it's heavily weighted on the negative, and, I mean, that's what they found, but I wasn't there. But it'd be interesting to get a response that would be carefully thought out, since the acting director probably didn't see this any sooner than we did, that some kind of response from the old board, some kind of response from the acting COA director, because I did some research too, and where there was no formal education or training program, I think they were developing a training program, and I'm not sure, what the date of that was, but I do recall finding that. And, it mentions the board, and it mentions the COA, not someone specifically, but I think that it would be interesting to get them to make a response to this presentation.
I appreciate it, and I really wish that this report had more positive in it. And maybe that's the next section, of when we have more information and we have, more data that we can put together and we can show the positive story of the COA. It positively impacts the clients every day.
I was just, it just seemed to be very negative, but maybe those are the facts possibly. I'll take your word for it. But in a presentation, it just sounds kind of dreadful. That it's also negative, so.
I think it hadn't been looked at in 41 years, so there's a few things that can happen in 41 years. So that's why this is kind of, and I think Commissioner Follett makes a good point. I think every department in this organization should have a review at least every 3 years of in-depth. I think that would, once you've established your benchmarks and you can build off of those, it's really kind of swap analysis. So it's just to make it better. And I think her point again is there just was a lack of leadership. And I hope we get that in place, then those things would happen on a regular basis, and I would hope this would be the last time you'd have a report like this that would be negative, because it would be taken care of and fixed.
Sonny, I think is
Well,
next, and then
I think the comment is that this report addresses the administrative side of the Commission on Aging. It doesn't talk anything about the services that are provided. You know, and how we got here, it really doesn't matter. This is where we're at now. How do we move forward from here? You know, the facts are that Commission on Aging made an annual report to the Board of Commissioners, but all their day-to-day reporting and functioning from the administration of the Commission on Aging was made to a Commission on Aging board, which was not this board. You know, whether this board should have been asking more questions, probably. You know, seeing where we're at now, probably we should have been. But, you know, at the same time, when I'm out throughout the community, all I'm hearing from the community is how great the services are going. So you know, did we drop the ball along the way and say, you know, hey, look, you know, where are we at administratively? You know, the idea that Commission on Aging employees, I really have a really tough problem when we talk about enabled employees were mandated to change classifications. I don't understand under any circumstances that we should be able to mandate redefining someone's responsibilities and deals. So I'd somewhere along the way, I'd like to have some explanation of what was that mandated change in their qualifications. The idea that we're in violation of county policies because employees were required to work weekends. We are a 24/7 operation, 365 days a year. We may have employees that have to work nights and weekends and holidays. You know, we just need to make sure that that is part of their job description. You know, but I think the big thing here is that, you know, and I will take some blame to it, because, you know, the County Board of Commissioners never overviewed the day-to-day operations of the Commission on Aging. They were reported to. You know, I've had some discussions at time with Commission on Aging board members that flat told me that was their money. Well, it's not their money, it's taxpayer money.
That's right.
And the important piece about that was, it's taxpayer money that the taxpayers asked us or charged us with providing services to our community. From my perspective, I was hearing from the community that those services were being provided. You know, and that was the important part to me. So, you know, I will take blame for the fact that the administrative piece went in. But this is critical of the administration of the Commission on Aging. It is not, at least in my mind, it is not in any way critical of the services that are being provided by the Commission on Aging.
Dan.
Or the heart and spirit that goes into of our employees entering people's private homes and blessing their lives. We're not degrading that. We're not denigrating. I applaud that. We're not talking about that. So I was going to. When do we get to the point where you tell us why you wanted to use Comfort Keepers?
Well,
We can do that now.
We wanted to look at an outside vendor to address the large majority of these issues that are administrative issues that were identified in terms of the supervision, in terms of the policies and procedures, in terms of the education and training, in terms of the antiquated process where we have staff cutting paper, pasting, taping paper to other pieces of paper, and a filing system that's incredibly labor-intensive and paper-based. And so for all of those reasons, as well as the emerging reason of HIPAA, in order to comply with the AAA of Northern Michigan contract, those were the reasons why we were looking for a solution to bring us to compliance with that, as well as to take advantage of the other opportunities that would address the significant number of issues in this report.
Okay, a follow-up question. Do you have any idea if we did hire somebody like Comfort Keepers to do those skills, those administrative things? Yes, we could do it in-house, but that costs money too. Would we save money? Would we lose money? Would we break even? Do you have any idea?
Just from my knowledge of operations and technology and what I've seen go on in other organizations is that when you take such a labor-intensive process that we currently have now and you implement technology, you're likely to see savings.
And why would you not want to make our existing staff do those things as opposed to hiring it out? Is it a matter we need to fix it right now? We've got so many other things on our plate? I mean, what's your feeling about it?
This is an extremely large and complex issue, not just the HIPAA, but the technology piece as well. I mean, it's a timely process. It's going to take bringing in, consultants to evaluate certain things. We're going to have to take time to review things. We're looking at probably a year and a half down the road for implementation into when we'll finally be able to start to track data and have information available. The idea of utilizing a management services provider was that already existed. It was tested. It was done. We were going to be able to hit the ground running with it.
They have the IT for it?
They have the IT for it.
And the difference being that if we empower our own people to do that and bring in new people if needed to do that, then we maintain our role within the community and within the county. We maintain the oversight. We maintain the responsibility. We don't privatize. I know you don't like that word, but we don't give it to someone else to do that piece for us. And we've heard recently from a number of sources about the aging, the graying of our community. We are the destination location for people to come to die, to grow old and die. And it's a wonderful thing because we are a great place for it. We are a great place for it. And so we need to provide for that. I mean, we're almost 100,000 people right now. We're going to be a lot more than 1,800 people who need these services. I think it's the role of government to provide for the health, safety, and welfare of their citizens. And I think we have the resources, people-wise and dollar-wise, to accomplish that. And I think it's wrong to hold this group of people responsible for the malfeasance, misfeasance, mismanagement that's gone on for however many years that's gotten us to this place.
I agree.
Madam Chair.
I agree with that.
Hold on.
I'm sorry.
Okay, Tom.
One of the things that drove my concern, and our council said it wasn't as great a concern, but we have governmental immunity. But if we show gross negligence, we don't have it. And I got very concerned about knowing that we were having these HIPAA problems. If anything happened, that we would be sued and be liable. So I was concerned about that. I guess I've been told it wasn't as great a concern as I thought it was, but my initial reaction was, I've got a symptom here that could be a potential problem. I'd rather deal with the symptom before it became a problem. So the other thing. The other issue is that, we will have a strategic plan. I just talked with someone that's doing it for us on our IT infrastructure 3 years out. He's promised it to me early March. If you've ever been down the slippery slope of IT investments, it can get very, very expensive if you're not careful. I definitely agree with what's been said here, that technology can really make people more efficient and help them. And I believe we can also keep a lot of things in-house if we give them more tools to do that and train them. But I'm thinking after we get this IT plan in place and we know what the funding is and what's going to be required after over a 3-year period, we can start getting into, once the foundation is built, into technology in a lot of departments to help them out in more efficiencies and effectiveness. But we've run into that, and people wanting to get software in an outdated system, AS400, it's a 1988 DOS based, that doesn't make sense to make those investments before you've got your where you want it to go for the next few years. So a compromise, a intern step may be to take care of some of these issues, maybe a shorter-term agreement to help us go through that transition while at the same time we're building the skills base and getting the things in place to keep it in-house more, but we need some help in doing that. So as compared to a long-term 3-year agreement, maybe shorter-term agreements with the understanding that we will have a plan and the new director would have a plan to bring some of these outside resources in-house with new technology to make it more effective. So I think that's where we'd like to go.
Yeah, I mean, I would almost suggest, and I hate using consultants, but I'd almost suggest using an industry consultant to figure out what do we need in IT, what do we need as far as to develop for training, and then we could do everything in-house. Once we've identified what we needed as far as IT, there's no reason. The other thing I wanted to throw... Say again?
Didn't the QAP just do that?
Yeah. Well, they didn't identify what you need. I'm saying the actual software.
Okay.
We'll need that you'd need to investigate. The other thing I want to throw out here, because we do this a lot on this board, is hammer administration and you know, all the people that work hard. And the fact is, this county for years, and we still do, we've set these people up to fail. We haven't provided them the training to succeed in their jobs that they're doing. So we need to recognize that when we're talking about the administration failed, like you say, we're all part of this. Yes.
They didn't
So
have
I
the
want to make
tools
sure
to
that's
succeed.
clear, that we're not hammering the leadership at COA specifically. I know you're taking that we are, but we are not. I'm saying we have set you up to fail by not giving you the tools to succeed in this. So. And hopefully we'll change that.
And I think that, to Tom's point, that I don't think it was that we don't think we need help. It was that I don't think that we needed to contract out so much to an outside contractor. Any of the services, or we've said several times, it's administratively that we're having some issues. So I had a problem with, why are we contracting out more than what we need here? And if we need some administrative help, okay, get the help that we need. Maybe hire a HIPAA compliance person to get us where we need to be, and then get the right people in. I personally had a problem with contracting so much out of the services that were going out to the people. That part is what I kind of had a problem with. And Sonny?
Well, I think, maybe even more so than that, this discussion that we've had tonight and the participation of the people that are in this room and the information that we have, that discussion had to be had before I was willing to have any discussion about contracting anything. Mm-hmm. I needed to have a true evaluation of the quality assessment panel. I need to talk about identifying the problems that we have. And I think it's very apparent. Our problems are, at least in my mind, are an administrative issue. Not that it's anyone's fault per se, specifically, but it's an administrative issue. And we've talked about it before. We tend to say, well, we haven't kept up with technology. Well, I've sat here long enough to see the IT department come every year with a price tag, and the resources were not allocated. So it's not the IT department's total fault that we're behind the ball. Technology is growing faster than any of us in this room can even fathom trying to understand. But the fact is that we now have identified specific problems that we have. Now let's talk about options of how to address those. And we can't take care of all of this at one time. Chris said we have to create a plan of how we're going to become HEPA compliant. We can work on that. We can work on figuring out what we do with our technology requirements to make that so as that we secure that information. We look at hiring or designating, maybe it's not a new hire, maybe we designate a HIPAA compliance person. I told Bob I have a daughter that has 5 people in her office that their sole responsibility is to make sure that she is NCAA compliant. And that you think these folks have rules? You ought to see what the NCAA does for athletes and coaches. But But the simple fact is that, you know, we now have identified the problems. Let's break this thing down and deal with it one piece at a time. Last week, we held a strategic planning session, and one of our key goals was to make sure that we're protecting those vulnerable citizens in our community. This is a perfect example of a vulnerable group of citizens in our community that needs our help, and we need to make sure that we're protecting them.
And I see on page 24 the options for the COA, not to jump too far ahead at this hour, but I know that tonight is just a talking session. We're not empowered to do anything. So are you going to talk us through these options?
Certainly.
Okay, thanks.
Yep. And this is my last slide. So there were 4 options that were identified, which is we could maintain or return to our status quo. I'd like to think that we've moved away from that status quo already through some of the changes that have happened. We could maintain our status quo for now, and then also make internal improvements, which would include hiring a HIPAA expert, hiring the staff and the training company to develop the processes. We have to work with IT, issue an RFP, for the IT software, have pre-bid meetings, and go through all of the processes that are necessary for an extensive and effective installation of software. We would end up going through a trial period. As I said before, we'd be at least 15 months out from being able to track data consistently and to be able to know where we're standing. The other option is that we could form an authority or an independent entity, as was discussed a while ago, and one of the reasons why the QAP was formed. At this point, because of the findings that we've concluded of the QAP, I would not recommend creating an independent authority because we don't have a standard of service that meets what we want to achieve as the county, from what I've heard. The other thing, was the management services agreement, which is a turnkey operation for management of the field staff and of scheduling, providing billing services as well as a number of other functions, which can be streamlined. It leveraged the expertise that's currently not available at the COA. It would immediately begin providing information regarding client services, frequency, tracking. We'd be able to have additional accountability. Some clients who sign work orders now may not remember signing those work orders and claim that a staff member wasn't there. If we implement technology, there's GPS and things like that can be logged into that actually show a track, and so we can address any concerns from clients. We'd immediately have those operational efficiencies, and we'd be able to provide our staff with the resources, training, and education which is necessary. And that was the primary reason why county administration brought to you the recommendation to enter into a management services agreement.
But you didn't bid it out.
No. May I address that question?
I wish you would. I said, but you didn't bid it out.
There wasn't an RFP process by which they would have bid it out.
And Jen would like to address that, so let's answer that.
The management services agreement that was brought to you was with our current vendor who provides backup services. An RFP for those services was issued back in June or July of last year. That was the only provider who responded to that.
Sure, but the scope of services was significantly less than the scope of services you were offering in the management agreement.
It was different, that's correct. However, there was a known system of services and a connectivity there that would make that transition period easier than bringing in someone who didn't know or have a relationship with the Commission on Aging.
Well, of course, that's always the case with a preferred provider, but the point is that we have a policy that encourages bidding, and it may be that there would be other entities that provide those kinds of services that would be interested in a $327,000 a year contract. So.
Dan.
I don't care so much who does the service. You're saying that you need some help right now to get through this gap. And it may be, I don't know, it may be that the amount of stuff you want that company to do for us is just the right amount, not too much.
Maybe.
I don't know. I know that these people have put a lot of work into this, and they're smart people. And we need this. We need some help right now, so these ongoing problems don't keep on going. So I'm thinking, I'd be for temporarily getting some help. There's nothing wrong with that. I do it in my office at times.
And I assume we're talking about this at our next meeting,
Well,
since this is not an action item meeting.
It's not. But the gentleman in the front row is going to explode if I don't let him make one very, very fast comment.
Very fast.
Very fast, please.
3 questions. One, can you streamline the old school system that we currently have? Like when a restaurant, when the credit card machine goes down, you got to use the swiper. 2, could you use the 30 employees that have the 60 boots on the ground that are on the front lines dealing with this whole process, be your consultants? And then I think, can you have a great night, I guess, on the other.
I think at this point, we need to direct the administration as to how we want them to proceed at this point. I mean, they've given us some options on this back page. Tom?
What's the plan for what the board is going to look like for the Commission on Aging?
The advisory board?
Yeah, what's the plan for that?
What was, did you have that listed out?
I do. So
We
here's
jumped
your
over
slide.
it.
I kind of skipped over this one. There are 4 members, and they have expertise in a number of areas that are applicable to the COA, including service. They'll be looking at service quality. They'll have financial expertise. They'll have a legal knowledge and have a knowledge of healthcare best practices.
And it's not the group that did the analysis? It's
No,
not the same group?
No, it would be a separate group, and it would be appointed by this board.
And those
when
are
do you-
citizens that would apply for those positions,
That is correct.
Like our other, okay.
If I may, we would...
When do you want to start that?
As soon as I have a director in place, so it will be soon.
We have a director in place.
Right, because we are now the Commission on Aging Board.
Correct.
At the moment.
Correct.
Okay.
And then,
I think one of the challenges to a new director coming on board is the amount and the magnitude of some of the challenges that are being faced. And so being able to provide whatever resources is going to be essential in order to helping that individual be a success. It's also going to take a teamwork and a culture within the COA that's willing to change and that's willing to do things differently. And that's going to be a challenge.
So at what point can we advertise for the GTCOA Advisory Board?
How about as soon as I have a start date?
Yeah.
Why can't you advertise it at the moment?
When are you expecting
Yeah, we could-
that?
Yeah, I
I
don't
hope
see
by the
why
end
you
of the
can't
week.
open it
We
up
could-
for
we-
people to
we could
apply
do it
for
right
those 4
away.
positions already,
So
if we know
next
how
week
they
is-
want to be divided up.
As an action item on our agenda for next week's meeting, we will have the discussion of advertising for the Commission on Aging Board members.
We can just go ahead and do it. I don't think the board needs to discuss it.
Yeah,
We can just do it.
We can get moving on it.
Okay, Madam Chair?
Yes, ma'am.
I would weigh in on the maintain status quo for now with internal improvements.
Okay.
I appreciate the lure of having a management services agreement for a short period of time, but my concern is that with the pace that things move in government, that short-term could become a long-term. And because the training wheels would be on, there would not be the impetus to move with all due haste to accomplish the things that need to be accomplished. My primary concern is the need for us to continue to have oversight and to continue to have, to do the job that we should have been doing. Even though there was an advisory board already in place, we gave them full force and authority to act as this board. They were managing millions of dollars in taxpayer money with no elected oversight. And shame on us that happened. So I'm in favor of the maintain status. If we're giving direction, that would be my suggestion for direction.
Okay. I think Tom was next and then Bob.
Yeah.
Just go down the line.
Yeah,
So-
everybody tell us what you think. Right down the
Yeah,
road.
I agree with what Cheryl said, but I just wanted to add that if there's any question at all about people being on a waiting list or people being underserved, when this other information comes out and you announce your director or the director and you announce the board forming, can you also put some kind of message out where people can know exactly who to call about service, whether they felt they were underserved, whether they were on a waiting list, or whatever that occasion is, that we can collect that information on top of all the publicity you're going to get for announcing a new director. It's a good time to ask that question and tell people specifically where to go.
like an 800 number they could call in on?
At least ought to know the number.
Yeah.
It'd be great if they
Yeah.
could just call in and leave.
The phone number instead of a email address.
Yeah,
Because
yeah.
not everybody has email, but everybody has access to a phone, hopefully.
Dan?
I think we need to do some PR with the community that our employees serve and with the employees. I think the employees need to know that we think they're great. They've provided services with no complaints all these years. So we need to get out as a board, we're thanking you. We're going to help you get better. We're going to give you all we can to help you be successful. We need to tell that to the clients that are out there worrying. So we need to improve our PR with the clients that they're serving and with our staff. I'm concerned about that because there's a lot of negative feelings out there that we don't really need to have.
Yeah, I mean, I agree with the maintain status quo with the internal improvements. I mean, I still think we should probably hire some consultants to help speed up the process, to develop the policies and procedures and that kind of stuff, and look at industry, what kind of software could we have? I think it's important for us to own it, to have the ownership of that, instead of having someone else own it, and then, when that contract's up, then you might be in a bind, because then you're going to have to address it then. So, I think it's important for that. I was looking and I found a 2013 client satisfaction study on the website. You might find it. I don't know if you have a new one, if anyone has done a new one, because this report said they were going to go every 2 years. So, but no, okay, and it's probably something that would be nice to have, but like probably everybody else here, I've never heard any complaints about the services that's being provided. So again, I think, when I look at the list, I guess I see a lot of this stuff, so I look at the positive side saying everything I saw is easily fixed. Really easily fixed, I think. It takes time is the most important thing, but there's nothing in here that was really, a real earth-shattering thing to me. And again, I go back to, even though I'm hard too on the leadership, we just haven't succeeded because we haven't given them the opportunity. So we failed in that. So I would just go with that, I guess.
Sonny, anything else?
Well, again, I appreciate everyone's time and effort here because this is important. It's important to our citizens' clients, and it's important to our citizen taxpayers. They have charged Grand Traverse County with making sure that we take care of the elderly in our community. I think that's a key piece of the discussion. One thing that we have to remember is we don't have to reinvent the wheel. We are not the only commission on aging in the state of Michigan. There are a lot of others, and they have found ways to be HIPAA compliant. They found ways to administer. They found software that works for them. We have in place an IT inventory, evaluation that's going, but and that's great. But the fact is, with not a great deal of effort, we can find how Shar-M or some of the other communities are using it and what software they're using. Because that software is out there. It's not, as some of us in the room are old enough to know, much of the software that Grand Traverse County is using was handwritten and developed for the DOS, the AS400 that we have. But in today's world, that's not the way that business is conducted. There's software out there to help us track this information. And now that we've got this moved up to the forefront, we're talking about it, I believe we can truly make a difference for our community, and I really believe that we can do it in a lot less than 12 to 15 months.
Anything, Ron?
The only comment I have, it was good to hear all the positive feedback on what the clients are getting, and that they are even willing to hand over a key to their house to these people. I do not want anybody that works for me to have a key to anybody's house because nothing good can come of it. All you have to do is have something come up missing.
Yep.
So I would,
I told you to bring your booze back, Ron.
I would, yeah, that's right. I would suggest anybody have a key, get it back to the client. Thank you, though.
I'm sorry. So I guess I get the last word here before we put it back to public comment again. I think excellent work in the quality assurance panel and all the work that went into giving us all this information. Because we haven't been the COA board, and now we are. So this is all valuable information to us, and if we're going to go forward and monitor how things are going on, we needed to know all of this. And I know it was very time intensive for everybody involved, but we needed that information. I think that we can do this. We can build this from the ground up, and we can do it the right way. And I think that the employees that are dedicated to the COA need to be part of that success. That success needs to be theirs. So Bob's right, we need to give them the tools to succeed, give them all the help that they need. But these are people that are truly dedicated to our seniors. And I don't want to eliminate them from the solution. They are the solution. We just need to help them and get the right things in place to do this the right way from right now. And we need to maintain control of this because the taxpayers mandated that. They said, here's the money, here's what we want it to go for, and we're giving it to the county to do this. So the county needs to do this. That is the mandate from the taxpayers. And I said I was going to have the last word, but Bob raised his hand and there's others.
Then I'll shut up.
Okay.
This comment I had was going to be about if we had comfort keepers involved, but because, the state board I'm on for the state veterans homes, a couple years ago, the state privatized CNAs. And it has been basically a fiasco, quite frankly, because of, everyone here that goes to the homes will tell you, the people love to see the same person come in and out. The problem we have at the state board or state homes is keeping the CNAs. I mean, CNA work is difficult as it is, much less in some certain environments, and that one's kind of tough. But when the member sees a different person every day, that's not quality care. Yeah. Because part of that quality care is having them an even temper and everything else. So that's something to look at. I'd come prepared to talk about that part because I have seen that, and we've done things to remedy that. And actually, we've increased the contract cost to increase pay and everything else, but it's a major issue with that kind of care of having different people come in and out. So.
Cheryl, and then Tom.
Okay, and I just wanted to state for the record that I will be making a motion at the meeting next week to rescind the vote in December to roll back the millage. I believe that with the direction that we're going, that we may find that we need those millage dollars. I have talked to both equalization and legal counsel, and we actually don't have to act on that rollback until September of 2017. However, I would like to ask for that vote as a public recognition that we are committed to improving the COA and using those resources, if we need them, wisely, and we will still have until September to make a decision on that. So I'll be making that motion for the next meeting, and I'm advising you of it today so that you'll be prepared for the vote next week.
And I'll put that on the agenda.
Attend, that means, you don't mean stop, you mean just delay.
No, rescinding a resolution
rescind,
means that resolution never existed.
I'm sorry, Dan, I said
It's
rescind the resolution. I'm sorry, yeah, the resolution that the old board passed in December rescinding. I would.
So to be clear, you'll bring, and I'll put it on the agenda meeting's tomorrow morning, that you will make a motion to rescind the return of the $750,000 decision that was made.
Correct.
Yes, got it. So noted. Tom?
Well, I just want to thank Laura Green for being here, present, and basically running the Commission on Aging. And maybe kick this public comment off. And thanks for everybody showing up. This is a very nice turnout. I was concerned how many people would come, and I'm glad everybody's here. Thank you.
So before we go back into public comment, remember the rules, 3 minutes, and everybody gets one turn. So if you've already spoken, and I already kind of let it go kind of a lot. So if you've already spoken, we're good. So we'll let people who haven't had a chance yet, and you each get 3 minutes. Go.
Thank you, and I'm glad I waited till the end. I did that intentionally. The comments I prepared tonight I'm going to not talk about because I feel that the first thing I need to discuss is, as a county employee since May of 2014, I'm the first one that can stand up and say, unfortunately, that as a good soldier and someone that's been dedicated and loyal and worked hard and really cared about the seniors here, that I have not been well treated or rewarded for that. And it's actually been a really terrible and challenging journey. And for the number one reason, quite frankly, on the memos and put up tonight and talked about tonight, this list as to why the QAP committee was even started to be associated with me, I disagree with, I challenge, and I will dispute on paper, in audio, and also from our COA board meetings. There were COA board members here tonight who can also support that for me and have offered to support for me statements in here that are inaccurate. In June 11th of 2015, I was told that our director, Georgia Durga, was going to be leaving our building and be going to the Gov Center. That it would be my responsibility with Paula Segala to basically run the operations of the Commission on Aging and take over the responsibility for personnel issues because we had a lot of problems. It was a very toxic atmosphere. I have documents that I can share with you, studies that Ms. Segala did of the COA that will document everything that I'm telling you. And myself and the supervisors that were there, we did it. And we have a dedicated team of field staff that are here that also did it. The policies and procedures that we had in place have been completely redone by Deputy Director Lori Wells and the previous Deputy Director Holly DeWalt in 2013. The director that was moved to this government center, when I stepped in, I inherited a lot of dysfunction and a tremendous amount of, nightmare is the right word. And I had a COA board of directors that really wanted to step up and do the right thing too, but they had to wait. And Bob Johnson is very well aware of what I'm talking about because he was part of a meeting on June 11th with Commissioner Max Bauer, Paula Segala, and I will have to come back and finish the saga, but
absolutely,
there is a lot more to this story, and I am not going to accept the accusations, and I have been a good soldier. I was told not to talk about QAP, I didn't, but I think it all needs to come out, so I look forward to having that opportunity to do so, perhaps in our own study session.
Okay, thank you. Anybody else? Yes, sir.
Thank you for the opportunity. My name's John Zimmerman, 1562 Keene Drive. For full disclosure, I own Bright Star Care. It's a private duty home care agency here in Traverse City. And for the last 4 years, I've also served on the advisory council to the Office of Services to the Aging. If I might make a couple of suggestions. One, look to some of your local talent. I would be more than happy to be part of any exploratory group to provide information, insight, and so forth. the Office of Services of the Aging went through a process for determining definitions of the various types of health care. We heard a lot of different terms thrown out here. I can provide that. In fact, Jennifer, if you'd like, I could send that to you. But it's what the State Advisory Council determined would be appropriate when people are talking about home care and all of the different services provided. To Dr. Dan, utilizing a outside source, would it save money? According to the contract Comfort Keepers was offering, it would reduce your administrative costs from $569,000 to $327,000. In private business, we try to keep our administrative costs at 15% of our cost of goods sold. So you're at 21%. So there's probably some areas where costs can be reduced. To address the comment that Ron made, we talk very, very seriously with our caregivers about client confidentiality and professional boundaries. You're right. Having a key to someone's home crosses professional boundaries, and it leads to problems. So I would simply ask to utilize the talent that you have in Grand Traverse County. There are some excellent agencies out there that have years of experience providing the same type of care that the Commission on Aging is providing, and we can provide information, whether it's policies. As a Joint Commission accredited agency, we know about standards of performance, and we certainly know about policies, and we certainly can assist or provide at least some insight. So I do volunteer my services should a committee be drawn up in the future. Thank you very much. I think this is a very important organization, Commission on Aging. They provide great services, and certainly the people here tonight that we're sponsoring or talking about the services they've received, I think that is really important, and I'm glad that everybody got to hear those comments. Thank you very much.
Thank you. Anybody else? Yeah, this gentleman and then this lady over here. Oh, sir?
Aaron Brown.
Sir, we
Traverse
did.
City,
What,
611
sir?
Hastings Street.
We did say one time per person. You've already had a chance to speak, and we did say.
A couple minutes, I'm leaving.
We said one time per person,
Yeah.
and you've already spoke once.
You want me to speak?
We need to move on to someone who hasn't had a chance yet, if that's okay.
I don't have my hearing aids in. I'm having a heck of a time.
Each person gets one chance to speak.
Why don't you let him speak?
Go ahead.
You will save a lot of problems if you end the DDA and the Brownwood Development Authority giving away so many taxes in this town. My taxes have tripled since 1979. Thank you, and allow me for come to speak.
Thank
Have
you.
a good evening.
It actually was a different topic, so I stand corrected on that one. Yes, ma'am.
Marcia Johnson, 7762 Wood Road, Kingsley, Michigan. And I wanted to just, as I was listening to all this HIPAA stuff, and I look at our county as a whole, I would think that HIPAA would be important for all of our departments to look at, with HIPAA, medical, confidentiality, because we have a jail that deals with, I'm sure, medical issues. We have medical issues that go through HR. We have medical issues that go through the the COA. So I think this is a county, a whole county issue that really we should have somebody come in and look at the county as a whole, because like Wendy was saying, everything's kind of interlinked. So I think it opens up a whole topic of conversation to look at all of us. So, thanks.
Thank you. Anybody else at all? Yes? Welcome, Cherry.
Cherry Wolf, Deputy Finance Director. I just wanted to touch a little bit on the software that the Commission on Aging is using. It is an old, very old Access database system that has been modified over the years. When I first came to Grand Traverse County 4 years ago to learn that the Commission on Aging was doing all their client invoicing, all their client receipting, keeping their client data, and everything related to the clients and the operations are kept on this separate access database system that has been pretty much kept up to date by one of our IT persons, who is primarily all that she does. And I know she's seriously trying to retire and feels a little excuse me, a little uncomfortable doing that right now. And so maybe the use or finding of a software system that might work for them might be a serious thing to take into account right now. What they do is they do all this work on their system, this access database system. They bring their receipts over. They're deposited at Treasury, recorded in the AS400. They send all their invoices over. We invoice and pay everything out of the AS400. We run the payroll through the AS400. So all that is secure and operating and working well. But it's my understanding in my conversations in the last 4 years is that this access database that they're working on is what seems to be the really labor-intensive part of the upkeep of the client data, the client invoicing, the client tracking of their systems. So, excuse me, I'm losing my voice too, but I would seriously hope that might be a big concern right now, and I really think that it may be a big money saver, with the exception of spending the money on a software that'll work for them and that may integrate a little bit better with our current system or a future system. But it really needs to have some attention drawn to that. We've talked with the former director. We've actually put money aside in the fund balance to reserve for software purchases for them to move forward with that. So I know that there has been some money set aside for that. And I, excuse me, just really think that that might help an idea for moving forward to move with something. But we've, and also a scanning system of some sort where they're not storing boxes and boxes of receipts in the closet. Any sort of a scanning system I would recommend.
Thank you, Cherry. Anybody else for public comment? Okay, so we'll close public comment. And I would just say that we would expect regular updates on progress that we're making, and I'll make sure that regular updates show up on the agenda at certain intervals. At regular updates, at regular intervals will show up so that we are kept informed and you're kept informed of what's going on. Thank you, we are adjourned. Thank you.
You did some good work tonight.